Hello everybody, I'm Dr. Mike Blaney. I'm a general and bariatric surgeon at Live Healthy MD in Augusta, Georgia. So today we're going to talk about ulcers after surgery. So what are ulcers? Ulcers are an erosion or eating away of the lining of the stomach that results in loss of the protective barrier of the stomach. And this is usually due to excessive acid production in most individuals, or even medications that can cause a erosion in the lining of the stomach. The symptoms of ulcers typically are pain, but could also result in bleeding, where an individual may throw up blood or even pass blood in their stool. Ulcers can also rupture, perforate, meaning leakage of stomach contents into the abdominal cavity, resulting in serious pain, and this of course would require surgery. Now ulcers can happen in anybody, but in the field of weight loss surgery, we more commonly see ulcers associated with the gastric bypass. Generally, we don't see ulcers occur with the sleeve gastrectomy or the duodenal switch. Now, why is ulcers more common in the gastric bypass? Well, this is because we bring a limb of intestine that originally was much further downstream, and we bring it up to the stomach and attach it to the stomach. So ulcers that occur after a gastric bypass are referred to as marginal ulcers. And the most common presentation that a patient may come in complaining with is abdominal pain. Ulcers after gastric bypass can occur early, meaning the first several months after surgery, or late, meaning many years after surgery. Sometimes ulcers occur just on their own for no particular reason, but many times our patients develop an ulcer because of some precipitating factors, such as smoking or taking anti-inflammatory medications such as Motrin or Advil that an individual might be prescribed to help with arthritis type pain. Many times I'll see patients come in, they might have had an accident, or their orthopedic doctor prescribed them anti-inflammatory medications and they weren't thinking about the fact that they could develop an ulcer, and then weeks later after taking the medication, they're coming in with pain. Ulcers after gastric bypass can bleed, and they can also perforate. One of the more common operations that we have to do on our patients after gastric bypass surgery is an operation to deal with a perforated marginal ulcer. So all of that sounds pretty scary, but the frequency of these events are pretty low. I tell my patients there's about a 5% chance of developing a marginal ulcer after a gastric bypass. The vast majority of the time the symptoms are upper abdominal pain and pain with eating, difficulty eating. We will make that diagnosis by doing an endoscopy, meaning a scope down through the mouth into the pouch, and many of you who may have had a gastric bypass already are familiar with this. Most surgeons will do an endoscopy before surgery to evaluate the inside of the stomach prior to doing these operations. So we'll treat an ulcer with medication, the typical ulcer medications that we would use with anybody, and most of the time it heals and goes away, and an individual's perfectly fine after that. Now, if somebody does have a perforated ulcer, then we have to operate to deal with that problem. If somebody has bleeding, again, we treat this with medication, and the majority of the time it heals. Rarely, but it does happen that ulcers can be chronic. They can heal and recur, or they just don't heal. And this is probably the biggest reason that we might, as weight loss surgeons, have to do a revision of the previously performed surgery, meaning if an ulcer is not healing, we have to go back and cut out that ulcer and revise or alter the connection between the small intestine and the gastric pouch. So don't forget to subscribe to our channel to see more of our videos, and give us a thumbs up.